Well, the Lord be with you.
And also with
Also
you.
you.
Let us pray. Gracious God, on this gorgeous afternoon, we give you thanks for this world you have made out of love. We give you thanks for the gifts of inquiry and curiosity and science. We give you thanks for the gifts that Dr. Anderson and Dr. Gwathney have offered us so generously since last year, when this pandemic was just a rumor and we were trying to get ahead of it. Gracious God, we ask that you bless this time, bless them in their sharing and us in our asking and listening. Help us to listen for your voice in all. Amen. Our plan for today is pretty simple. We want as much time as possible for them to share their insights and wisdom, particularly as the landscape has changed twice actually since Dr. Gwathney was with us in December and enlightening us about the vaccinations. Now, many of us, if not most of us, have been vaccinated, but then the Delta variant threw us a curve. And so our autumn is not looking like the autumn we thought we would have. And so I know we have a bunch of questions, but I would just like to give Dr. Anderson and Dr. Gwathney the floor. I would ask that we not, that you hold your questions. The chat can get very distracting if we are suddenly peppering with questions. When we have a chance to open the floor for questions, your chat is a great place to put those. So we can answer those in order. But in the meantime, if you could refrain from using that tool so we can stay focused on what Dr. Anderson and Dr. Gwathney have to say, that would be great. Does that sound like a plan? Okay, doctors, the floor is yours, with our gratitude to both of you.
Yeah, hi everyone, and thank you, Mother Paige. Jamal and I have structured this so that I'll begin with some opening comments. I'll talk a little bit about general considerations at this point in the pandemic, what the epidemiology looks like currently, a bit about the public health measures that are in place and some that aren't. I'll put on my thinking about the future. I have no ability to predict it, but I will tell you what I know at this time and transition over to Jamal to talk with us a little bit about, what vaccines are currently available, whether or not they are as effective as we think they are, and follow up a little bit more with how important and impactful vaccinations can be. Jamal, did I lay that out okay? Is there anything that you want to say in opening remarks?
No, that was perfect. Thank you.
All right, you're welcome. So here's the format that we're going to use. I'm going to talk for about 15 minutes. I'll transition to Jamal and he'll talk for about, well, actually, I'm going to leave mine to 10 so that we'll give you plenty of time for questions. I'll talk for about 10. Jamal will probably talk for, 10 or 15. Ideally, we want to have the floor be yours for at least a half an hour because we both agree that the best part of this is answering the questions that you've come to ask. So I have just a few slides that I'm going to show, and I will, if it's okay, Mother Paige, I'll share my screen. Okay. Jamal, give me a thumbs up if you can see that okay. All right, awesome. All right, so, a part of why we've been invited back to chat with you, besides the fact that we love you all, is that I think, we were all in a headspace thinking that, or many of us were in a headspace thinking that we were in the summer of freedom, right? We'd gone through 18 months of this really interesting time where we're in a city where we have a wonderful academic medical center. We have one of the best public health departments in the country. And we, generally have a really nice life here in San Diego. We travel back and forth to our works, our schools, our, recreational activities, often in traffic. We may not like that part too much, but we enjoy a very bustling and really generally nice life. The culture's good here. The restaurants are good. Schools are great, right? We're ready to get back to what we're accustomed to. However, February 2020, Mother Paige, do you remember that Saturday morning when we were on the telephone? Really threw us all for a loop. We had a state of emergency declared by our local county public health department. They did it on February 14th as an act of love. And in March, we had a pandemic declared across the entire nation and across the globe. So it changed life as we know it. And one of the things that we were asked to do was to respond to SARS-CoV-2, which was coming into human cells, and the entry points were through our noses, our mouths. At the time, we were concerned that, smear infections mattered. So if, we had touched or come in contact with something, we could put it into our noses and our mouths via our hands, etc. We were concerned about, sneezing, coughing. Later on, we learned that not only were those things important, but the amount of time and the size of the particles of infection, amount of time that they hang in the air and how big they are when they're in the air really mattered as well. So we started thinking about aerosols. And all of the public health measures that were put into place were intended to interrupt that whole way of this virus getting to humans. So we asked people to put distance between themselves. We asked people to ramp up on hygiene, making sure hands are clean or sanitized. We asked people to wear masks to protect the places that virus can exit your body or come into your body. And we found our way into a place where we were able to do that, right? We had people distancing by not going into schools. And for us, we weren't going into our churches. We had people masking. Our restaurants were largely empty on the insides. We found ways to do outdoor dining. And because so many of us were at homes, it wasn't unusual to find the grocery store shelves, devoid of products, because we were all preparing to hunker down and get through this time. Additionally, we also went through quite a stressful period, right? We were physically cut off from our loved ones. Some people say their friendships worsened, particularly our younger adults. Some people lost loved ones to COVID. For those who are empathetic, we were absorbing a lot of the stress and trauma that others were experiencing. And we had some racial reckoning to do. The Black Lives Matter movement really took a stronghold. And I think coming out of these 12 or so months really left a lot of people feeling grouchy, fearful, they were fed up. And dare I say, there's been a lot of grieving that people have had to do. So I just want to, before, Jamal and I get into technical things, I want to encourage us all to really just acknowledge that it's been a tough year. There's a shared humanity in all of it. When you are either, in the place where you get to make a decision or a decision is being made for you, really do try to listen and be compassionate and empathetic, be as transparent as you can be about, the things you know and you don't know, and give people the permission to just feel a little odd right now. There are just going to be times when someone's reacting or behaving in a way that doesn't seem to make any sense at all to you, but I think that is a part of what this new phase of being in the pandemic includes. So it's our physical health, and it's our mental and emotional health, and our spiritual health naturally. So I just want to bring us now into kind of where things are at the moment. So you'll see on my screen a graph that on the left side, or on the y-axis, documents the number of cases. So you see the scale here goes from 0 to just above 5,000. And on the x-axis, there's time. So this reflects roughly what was going on around Memorial Day moving forward into now. This was Memorial Day of 2020. So if you look as we got to November, when we would probably think of what was our second surge in COVID, things peaked. Everybody kind of anticipated that. We were in the fall. These seasonal viruses tend to do that during the fall. But then we had quite a bit of, I guess, a bit of a break. And naturally, as the vaccine became available and people were, I think, more routinely doing some of the public health measures that were important for minimizing transmission, we saw that our rates here in San Diego really got down quite low. But if you look at right around the end of June, we started to see things peak up again. And I've tracked here for us right up until September 11th, which was yesterday, where you can see we had just over 1,000 new cases in the county, and our 7-day average is up at about 790. Prior to that kind of mad increase that you see right there around June 25, we were down below 100 cases per day. I should also point out here that we reopened the entire state on June 15th, and it took about 2 weeks to see what happened from there. I will not editorialize further. I will just go on to say that there are some things that we do to assess the health of the county, and they include these 13 indicators on the screen right now. We keep track of how many cases there are over a 7-day period. We think about how many community outbreaks we're experiencing. We think about whether or not there are other illnesses that are floating around that might put a burden on our public health system or our medical system. And then whether or not our hospitals, our ICUs, our personal protective equipment supplies are in reasonable order. And then there's a public health response that's important with all of this around making sure that we identify people who have infections quickly and remove them from the circulating population. So I don't think it's lost on any of you that having 5 red X's on the screen right now is problematic. So every time I hear someone say, oh, back when we were in the pandemic, I just take a deep breath and I go, we're still in pandemic status and things still do matter. Or back when I hear people say, if you look at that middle part of my screen around hospitalizations, well, you know, at least the hospitals aren't full. Yes, the hospitals aren't full, but with every infection comes a 10-day isolation period for the infected person, meaning they cannot go to work, they cannot interact in our communities in the way that are helpful and healthy. And so this is not just about hospitalization and death, it really is about the larger context of us being well and contributing and productive members of society. So that said, we're coming to a place where I think we want to cross this bridge, right, into pandemic status and non-pandemic status. And none of us are really sure which way we're going to end up going, because it's really hard to predict human behavior. There's some things we can predict, but not that. And human behavior is a major factor in how things are going to roll out over the next 3 to 6 months. I will show you something, though, that for me is telling about human behavior and the importance of prevention as we think about how and what we do. So this is one of the most impactful slides that I came across in 2020 while we were earlier in our days of the pandemic. And you may remember that when the Wuhan, China data first came out, every person that was infected with SARS-CoV-2 was likely to infect roughly another 5 people. And when we put physical distance between us, the amount of transmission went down dramatically, right? So what's called the R0, or how many people get infected, went from roughly 5 down to just about less than 1. Now it should have been even lower than 0.8, but it wasn't. And being that different because of social distancing meant that it was helping. So, and we didn't have a vaccine at the time. We had no medical intervention. So this public health intervention was really important. Furthermore, our predictive models told us something really, really important. And that was that if we had just let things go on without public health intervention, we knew we had no medical intervention at the time, we would have lost here in San Diego County, and by lost, I mean, these would have been deaths, about 12,700 people. Register that for a minute, right? If we'd done nothing, we would have had over 12,700 people die in this county. We put those public health measures in place, and instead of over 12,000 people dying, we observed 128 deaths. Now, this is the last slide I'm going to present before I pass things over to Jamal, because I just want to remind us all of the importance of public health measures and medical measures while we're in a pandemic status. Number one, we, in the absence of the vaccine, had at our disposal physical distancing, masking, hygiene. We added in early January of 2021, the vaccination. And we initially, I think, had a situation where it was miraculous if anyone got a vaccine in their arm. I mean, it was such a hard thing to do, but we progressed through that initiation and then got to the place where we couldn't get people to come in and get a vaccine in their arm. And over half of Americans decided back, in July, back at the time in July when we last took the poll, that they weren't going to get a vaccine. So the choice, I think, is either we continue to do the things that the public health measures that we know work, or we add the medical interventions to those public health measures, like the vaccine, in order to eventually get to a place where we can eradicate and control SARS-CoV-2. There's really nothing in between, right? We're going to have to do the kinds of things that we were doing back in the early days of the pandemic, or get our vaccinations done. So I will, at this point, transition to Jamal so he can talk a little bit more about the vaccines, how they work, what types there are, and why they're so important.
All right. Well, thank you, Cheryl. Thank you, Mother Page. And it's great to see so many familiar faces here. I'm going to try and share my screen as well. So vaccines. So one of the big differences from, I guess, my last talk back in December, when I said we don't have vaccines, we don't have treatment options. We have all of that right now, and it's really up to us to utilize them to get us to that post-COVID stage that Cheryl was just mentioning. I'm going to talk about what we have right now as far as vaccines, talk about waning immunity, talk about boosters, and we can even talk about, I'm doing the clinical side, children and older adults, things along those lines. And then even the current treatments that we have. So, right now you can see on this slide, I like this slide, the one-word words matter. This second row, it reads approved for what ages? I would change that one word approved to authorized. As we know the difference between authorized versus, approval, and you can take a screenshot of this if you want, or it'll be recorded. So all of these are currently authorized. I'm sorry, Pfizer, Moderna, and Johnson & Johnson authorized. AstraZeneca and Novavax have not been approved for use in the United States. Novavax is going to submit for EUA authorization next quarter, in the fourth quarter, and AstraZeneca, we don't know just yet. So as of right now, Pfizer is the only one that is approved for use, and it's actually only approved right now for 16 years and older. The 12 to 15 is still under the authorization. And so we are highly, highly recommending that folks get vaccinated. Why do we want people to get vaccinated? Cheryl went through a lot of those things. I'll give you some numbers, but vaccinated versus unvaccinated, you're 4.5 times more likely to be infected with SARS-CoV-2 if you're unvaccinated. And if you're unvaccinated, you're about 10 times more likely to be hospitalized and or die from COVID versus if you were vaccinated. Preventing, so these vaccines definitely, what are they supposed to do? They're supposed to prevent you from getting sick enough to be in the hospital, sick enough from being on a ventilator or dying. And they do decrease transmission very slightly, and I'll explain how. They do not, we have seen maybe with the original, the Alpha variant, it may prevent infection. It's not preventing infection from the Delta variant. We know that. So we do know, comparing vaccinated and unvaccinated patients, that you do get infected. You do have the same amount of virus that you shed, whether you're vaccinated or not. The one slight caveat, if you're vaccinated, you may shed that virus for a shorter period of time, maybe 2 or 3 days versus the 5 to 7 days that you would be contagious. So it does help in that format, that it will shorten the time that you're actually infectious, but you still have the same amount of virus in your body. We've done that research. I think things certainly changed with the Delta variant. Vaccines pre-Delta variant were protecting or preventing mild disease at about 91%. Now, post-Delta, it's about 78%. Still works, but just a little less. It's still preventing, the vaccines are still preventing severe disease. Like I said, hospitalizations and death, still in the high 90%, still doing that for severe disease. And interestingly, the hospitalizations and death rate has stayed constant pre and post. And that's just not the percentage, but the sheer numbers, because if you have more cases, if you have with Delta, it's more transmissible, then you're going to have more hospitalizations and more deaths. The percentage necessarily hasn't changed. So boosters, and should we get boosters or not? And I'll differentiate. You'll hear a booster versus an additional vaccine. And there's those two terms, that terminology out there, an additional shot versus a booster. And basically, they're the same thing. It's a third shot if you had 2 originally. And the goal is the same thing, to increase your antibodies. So the goals are all the same. Now, the original part, your baseline determines whether you're getting a booster or whether you're getting an additional shot. I'll go through additional really quickly. You're getting an additional shot if, when you first got your first 2 shots or your Janssen 1 shot, that you were in an immunocompromised state and you probably would not mount a proper antibody response. And so that's obviously a special category. And the recommendation is your additional shot is at 28 days after your second or first shot, your second shot, we'll say Pfizer or Moderna. So after your second shot, 28 days. Now, that's just for immunocompromised, moderately to severe immunocompromised folks. You're getting an additional shot. Everybody else is getting a booster. And the booster is just, you've mounted the normal response with your first 2 shots, and now you've had some waning immunity. It's gone down. So, and we've done the research, about 6 to 8 months afterwards, your immunity goes down. It doesn't go down to 0, let's be clear. It may be from, let's say, 90% down to 50%. And so that waning immunity, you should get a booster to, again, increase your antibody response. And so that's what everyone who is not in the immunocompromised conditions are getting boosters, again, at that 8 to 8-month mark. Interestingly, boosters do work. There's research out there that Israel mandated a 3rd shot of Pfizer. Basically said, if you're eligible, if you don't get it, then you will be, your vaccine card will expire. That's what they told everyone. And so they have vaccinated pretty much everyone with a 3rd dose, and 2 weeks, the last 2 weeks, their cases have dropped dramatically after their boosters. Now there's talk about whether we should mix vaccines. So obviously the official recommendation, no, we don't mix vaccines. The CDC actually does has a statement, a small little paragraph. We don't recommend mixing, but if there's a supply chain issue or you don't know which one you got the first time, you can use another mRNA. So if you got one mRNA, you can get the other mRNA, so Pfizer versus Moderna, but you shouldn't mix with other vaccine types, just the 2 mRNA types. I'm going to see the next slide here. Well, this is, we'll stay here. Children, I'm going to talk about children right now. About 15% of our cases now are pediatric cases, which is significantly higher than before. I didn't do the research what it was before, but about 15%. And in California, it's about 14.2% right now under the age of 18. And so those cases, we're seeing a lot more pediatric cases. Obviously, they're not as severe as adults. I mean, they don't have many of the complications, but you have heard of the multi-system inflammatory syndrome C, for children. And that's something that we're doing active research on, but they can contract COVID, they can transmit COVID, and we're waiting for many of these companies to get the shots back, authorized for the younger children as well, once we know it's safe and effective. Let me see, last thing, monoclonal antibodies. So treatment options. There is a treatment now that we use. I've been using it in the office quite a bit, not only for people who have COVID-19, and they're high risk for complications, say with heart disease or over 65 or obese, things along those lines. They can use this antibodies, and you give them to the IV. They've even made it subcutaneous, meaning just under the skin, to make it easier to administer. And that helps keep people out of the hospital. We've been using it quite a bit at my office. They've even authorized it to be used for what's called post-exposure prophylaxis. So I'm high risk, and I've just been exposed to someone who is COVID-19 positive. You can use these monoclonal antibodies to hopefully prevent you from actually getting COVID-19. Again, you have to be in the high risk category. You cannot be vaccinated either. That's one of the criteria: not vaccinated, high risk, and not be sick enough to be in the hospital. I will quickly talk about just really long COVID. And we don't know a lot. Let's just be clear. This list here of all the potential symptoms, there's 22 here. It's a catch-all. We are creating long COVID clinics for people to go to so that we can figure out, what might be causing this, what the potential treatment options might be, for different symptoms. But, the brain fog, chronic chest pain or coughing, rashes, people get, skin issues, GI things, diarrhea, abdominal pain. All of these things are becoming more common the more we see cases. So again, we can hopefully try and prevent a lot of these things by doing all the public health implementation that Cheryl talked about and getting vaccinated. I want to be clear, the monoclonal antibodies is not a substitute for getting vaccinated. Please get vaccinated. And I think I will stop there and start with questions. All right.
There we go. Well, my thanks to you both on behalf of all of us here for giving us that introduction. There's a lot of information we've heard, and some of our questions may have already been answered, but I want to invite you all to either put in the chat or use the hand raising function so that moves you, because we have more than one screen here, to be able to ask your questions. So I see Cindy Clemens. Hi, Cindy. And Judy.
Hi. Hi. Thank you so much, Jamal and Cheryl. This is really, really helpful. I'm wondering if we should go ahead and get flu shots now, or if we should wait for our booster, because I've heard the booster may have the flu shot embedded in it. Is that something?
I know Jamal has really beautiful recommendations around optimizing when to get the flu shot. So Jamal, maybe
Okay.
I'll let you, talk about that piece. I have heard nothing about the boosters having flu protection in them. I
Okay.
will tell you though, that a part of, when you look at the epidemiology of flu, remember I showed that the triggers that we watch for, flu is one of them. The measures like keeping our hands clean, wearing our masks, keeping a little space between us all are also relevant to flu. So that helps to keep flu at bay.
Okay.
Jamal, please do talk about flu shot timing, because I love the way that you, I love the strategy that you have on this.
Oh, I hope I'm going to say what you're thinking. But no, did you mention you thought they were going to be combining the two?
I had heard somewhere that there was a combination. I mean, I think I heard that on the news or somewhere, not from a doctor, but.
I have not heard of that yet. That doesn't mean that it's not possible
Okay.
and even probable. It would be okay to get them both at the same time. The CDC has made that, clear that you can get them both at the same time. I generally advise, so flu season, the highest peak times are December, January, and February. And so it takes about 2 weeks or so to get your immunity, just like with COVID vaccines. So I've been generally recommending for years that folks get their vaccines maybe mid-October, so that by November 1, you're fully vaccinated, and then December, you're protected, December, January, and vaccines, just to be clear, flu vaccines generally last for 6 months.
Okay.
So from November on, 6 months, you'll be clearly protected. So that's generally when I advise folks to get their flu vaccines. Was that it, Cheryl?
That's it.
Okay, that's good. Thank you very much. So go ahead and get the flu shot is what you're saying. Don't avoid that.
Yeah, don't avoid that. No.
And then get my booster the 8 months after my last vaccine.
Yeah. Yes.
Thank
Perfect.
you.
Great. Thank you. Great
Okay.
question. I've been noticing those signs up at the pharmacy and whatnot as well, and wondering the same thing. So thank you for asking that, Cindy. Judy
Sure.
has her hand up, and Molly, I saw your comment in the chat, and also then Nancy. So I've seen you. And there's Lillian. So Judy, what is your question?
Okay, well, my question is, when you're supposed to be in a rather large group of people indoors, no ventilation, and supposedly everybody has to show proof of vaccine and is wearing masks, supposedly. How safe or unsafe is that to be in that situation? I've been waiting for this talk to find out.
Yeah, well, I can start.
Go ahead, Cheryl. Yeah.
I can start by saying, it depends. Right now, we're in a situation where we have a variant of SARS-CoV-2 that is highly infectious. Now, remember when we originally started talking about, the original SARS-CoV-2, I was saying, okay, everybody, like imagine flu, like a little bit amped up, like this is a very contagious situation. We're in like very contagious squared. And to put yourself in close quarters with a lot of people, with no ventilation, even if everyone were vaccinated, given the factors that Jamal just mentioned, with the waning vaccine effectiveness and a clear observations that when vaccinated, you can still get infected. Now, mind you, you are protected from hospitalization and from death. However, you can still pass that infection on to someone. I think all of those things taken together would make this, Judy, a very unsafe move. So I would not recommend that you go into a venue of that sort unless, you were going to be masked in a very high quality mask, KN95, maybe a double masking situation with your head like sticking out the window of the room. If you had to go in there, then you wouldn't want to be in there for very long.
Okay, thank you. That answers my question. I'm going to do my job and sit in my car.
Bless you, Judy. And that was
Perfect.
an important question. I know there are so many. I'm sure as we all sat here, Judy, listening to you ask that question, we were all imagining our own version of that scenario, because what you described shows up in any number of environments we find ourselves in. So thank you for that reality check. And so,
You know what, Paige? I'm just gonna throw out some numbers here for
sure.
pre and post Delta.
Yeah.
So because Delta variant changed everything. So percentage of cases of fully vaccinated folks pre-Delta was only about 5% of all the cases were fully vaccinated. Now it's about 18% of all the cases are fully vaccinated. And it's the same with hospitalizations. It was 7% were fully vaccinated. Now it's 14%. It's doubled. And then deaths were 8% fully vaccinated cases, dying. Now it's 16% of, all the cases that are dying, 16% are fully vaccinated. So the vaccine is, again, as Cheryl said, try to stay away from as many people as you can for as long as you can. I don't go to big crowded places. Right now we canceled or postponed the major event that the bishop sent out. And so, yeah, it's not advisable at this time. But I'll stop there.
Thank you. That's why St. Peter's is going to be continuing outdoors for some time, beloved, because that description pretty much is St. Peter's worship space, darn it. So thanks for, I promise I did not ask Judy to ask that question. Molly, you put a question in the chat.
I can speak it. Is there
Sure.
any data about the incidence of long COVID in post vaccine infections?
So I can, you want me to start on this, Jamal? I'll just tell you a little bit about the best data that I've seen around this. It's collected in Wuhan, and they enrolled individuals, general free living individuals, not in a hospital or anything, and queried them about who had been infected and queried them about symptoms for 12 months beyond the original infection point. And roughly 67% of those questioned reported having a symptom or more over the next 12 months. So those are the best data that I've seen so far. And so to me, that's non-trivial, right? To have that many people saying, oh yeah, I still got a thing going on, but it needs to be replicated. And I think a little bit more of a global sample would be helpful.
I think what you're asking was post-vaccination long COVID. And no, I don't think we have a lot of that data yet. 67% of people who get COVID, may have symptoms for 12 months. But if you've been vaccinated, if you get COVID,
so the breakthrough infections,
we don't have that. We don't have that data yet.
Those breakthrough infections, we don't have a lot of data in those people yet.
That's what's keeping my mask on right now and keeping me from feeling bulletproof about having been vaccinated. Okay, thank you.
Yeah,
Thanks,
you're welcome,
Molly.
Molly. That and protecting others, right? Even if you felt nothing, if you were to get infected, the fact that you could asymptomatically pass that on to someone else is why I put my mask on,
It seems like this variant is just genius. And I mean, if you want to make sure you transmit to a whole bunch of people, make sure that the vaccinated folks don't even know they're infected, right? We think we're safe. We think, I'm beyond this. I can do what I want while we're running around infecting people because we have no clue that we're not well. So it's an evil genius. It really is. Nancy McMahon has her hand up. Hi, Nancy.
Hi. So my questions have to do with children. And first of all, if a mother is fully vaccinated, does she pass any protection along to a nursing infant? And then I had heard that Moderna was actually trialing children in the age 2 and up space, actually for business reasons, because Pfizer was already in the 5 or 6 and up, so they figured they'd go there. I don't know if that's true, so I wondered if you'd heard anything, and if you have any sense of the timing as to when those trials might be concluded and hopefully a vaccine available?
So for your first question, yes, nursing mothers who have been vaccinated will pass antibodies on to their infant, their nursing infant. So we do recommend, the American College of OBGYN recommends that pregnant women get vaccinated if you're nursing, to get vaccinated. And so that is one of the best ways to protect the child, because obviously they can get vaccinated themselves. And infants, under the age of 1, have a high risk of complications because they don't have their own immunity and they can't get vaccinated. So a breastfeeding mom definitely is highly recommended. Moderna and their 2-year, I believe they are doing the studies for 2 to 5. Now, when those data will come out, it's probably going to be sometime, at least probably 6 months before data comes out, and then maybe another 3 or 4 months before any type of, consideration by the FDA and when for emergency use authorization at that point. So it will be quite some time before the 2-year-olds are getting vaccinated.
Okay. I actually have a follow-up question on the nursing mom thing, with the idea that once you've completed 6 months after you've completed your series of vaccinations, waning starts. Does that suggest nursing moms should sort of be at the front of the line for the boosters because they're protecting a second little person?
That's a viable question that probably people smarter than me are going to consider. But I think it's viable. To your point, I think I've read the boosters and who will get the boosters and in what order will probably mimic the original vaccine rollout. So healthcare workers, those in long-term care facilities, frontline workers, and it will probably follow that pattern from what I've seen thus far. But you raise a valid consideration.
Okay.
Yeah, and I'll just add to what Jamal responded, Nancy, that there's a registration for a Moderna trial in ages 6 months to under 12.
Mhm.
It was registered in March of 2021, and it has an estimated study completion date of June 2023. Now, it doesn't mean, like, Jamal took part in the Moderna trial here. It doesn't mean that they won't stop early and release the data that they have, should they have, sufficient data of benefit or harm. But right now, it's data collection is ongoing, and it has a stop date of June 12th, 2023.
Okay, thank you. Thank you both very much.
Thank you. Great questions. And Lillian has her hand raised. Hi, Lillian.
Sorry, my picture isn't there. I couldn't figure it out.
I can picture you in my mind, dear. Okay.
Okay. About a year ago, I had some surgery, and after the surgery, I came down with psoriasis. And it's been quite a battle. And since my immune system is attacking my skin, would it be dangerous for me to take the booster, or how do I make the decision about the booster?
So you've already had your first 1 or 2 vaccines of it?
And I'm not sure if they made the psoriasis worse or not. I have no idea.
Okay, all right. That's certainly a very, individual question that obviously you definitely want to talk about that with, your providers and your rheumatologist, if you have one. You might want to, have some lab work done before to see if you have any allergies to any of the components in the vaccines that you've already had, if you have Moderna or Pfizer or Janssen. And so I would say you should look into getting a booster, but definitely do your due diligence and make sure that it's safe for you. It's something that I would want you to look into and try and get it if at all possible.
Well, I have talked to my dermatologist and my and another doctor, and they say get it. But what about the flu shot? That's another one. Does that have a live virus in it that would get the attention of my immune system?
So interestingly enough, there's two formulations for the flu. There's a nasal spray, which is a live virus. So I would not recommend you get the nasal spray. The injection is not a live virus. So it should not cause any issues.
Well, I hope this helps other people too, because I might not be the only one with these questions.
Oh, thank you, Lily. And we all have our own decision trees, but sometimes those branches look a lot alike. So thank you. I appreciate that question. And look forward to hearing what you decide. Debbie Z had a couple of questions in the chat. Debbie, do you want to go ahead and ask both of those questions while we've got you?
One is just in general in outdoor settings, given how contagious it is, do we need to be watching out, like standing in a line, making sure somebody behind us stays away? The old Globe opened up and they had outdoor theater. Everybody was either supposedly vaccinated or 3-day test, but the audience was the cast was still going up and down the aisles, interacting with unmasked people on the aisle, like a foot away. And then at the end, they had everybody stand up and sing.
Okay, well, that's a scenario. So what is it? So outdoors, what difference does the Delta make with outdoors, or what difference does outdoors make with the Delta given its increased infectiousness and all of that?
Yeah, I'll start here, Jamal. There's so many considerations, right? So there's not just being indoor or outdoor, there's also what you're doing indoor or outdoor. So one of my favorite little studies that got published about a month ago looked at people who were together breathing, talking, and singing. And it probably will come as no surprise to you that the viral load, first of all, varies widely from person to person. So it depends on what kind of people you're with also. Singing emitted the largest viral load, talking the next lower, and then breathing the next lower. So they're not all considered equal. And there's a difference between sitting in an outdoor activity talking softly with each other versus sitting in an outdoor activity screaming and cheering. Like we go to soccer matches for AJ. There's a lot of if there were virus on the sideline, it's coming out when people start to cheer. And then there's singing, which generally brings out the most viral particles. So I think going back to the basic measures of when you're with other people, if you're unable to distance, if you're in reasonably close quarters, cover your portals of exit and entry and keep your hygiene game good. and I think you should be okay.
Thanks for that.
The
You had another
second
question about cards and vaccination cards.
and the question is, do we have any idea of how many false cards are going on out there?
Okay, so no, but this doesn't even make any sense to me. Like, if you don't want to be vaccinated, don't then falsify and say you have been vaccinated. Like, right? Stand by that decision. And
No.
I don't get anything about falsifying a vaccine card. I have no idea how common it is. I think we probably, get the more popular stories widely circulated by the media. However, just get your vaccine or have a good reason for not doing that and stand by your good reason.
Thank you. Deacon Bob.
My 55-year-old son is in the 4th week of having COVID. He was an anti-vaxxer and has claimed he was told by somebody in the Kaiser Permanente hospital in Oakland that because he has it, he's now immune and would not need any further boosters or anything like that. Is that true?
Jamal, you're on mute.
I can take this one. So the current recommendation by the CDC is that even if you have had COVID, that you are still advised to get a vaccination. That was probably more relevant pre-Delta. Now that we have Delta, certainly did he probably have Delta? Yes, most likely, and would be potentially immune. But now that one infection now only protects him against that one variant, whichever one he was infected with, and will wane over time, faster than a vaccination. The vaccine will give you protection against several variants and potentially longer. So the current recommendation is still to get vaccinated, even if you've had COVID-19.
And Deacon Bob, first of all, let me just say, I thought you were going to say my 55-year-old self.
Yes.
No, it's the 82-year-old self.
but I have a story that I want everybody in the world to hear. Someone in my lab is fully vaccinated and has a son who was an anti-vaxxer and contracted COVID, as did his best friend, also an anti-vaxxer, got COVID. Her son ended up in the hospital on a ventilator. She drove him to the hospital, they're trying to care and provide for him. She said she kept thinking to herself during that transition period that it would be a miracle, right, if she didn't get the infection. Now, she fully vaccinated. Her son, when he was in the getting admitted, he learned that his best friend, who was also infected, passed away. So died. These are young people, died from this infection. And then eventually, over 2 or so weeks, he got better enough to go home and went home with an oxygen tank. It turns out she called me up because she did get infected with COVID. So here she is in her 60s, fully vaccinated, infected with COVID, barely feeling a thing, right? While her adult son, hospitalized, now, home with post, hospitalization care, and best friend who they've all known, all of his life, deceased. So it just, goes to show in sort of a real life context what Jamal was mentioning earlier about the increase in real morbidity and mortality that happens, the differences that happen between being vaccinated and unvaccinated.
Thank you. And ongoing prayers for Eric, Deacon Bob. Yep. Nancy Chapman, you had also commented on the Old Globe and other theaters being opened, and I see your hand up. Did you have another question in addition to that reflection?
No, I had just that question. We have tickets to the Old Globe and to the North Coast, and they've sent out notices to us that we have to have masks and vaccinations, but it sort of sounds like we really shouldn't go because they're indoors. From what I've heard from people, they're pretty full. So could you comment on that?
I don't recommend any large gatherings indoors, regardless of your vaccination status and regardless of masks. I don't make that. I don't go myself personally, and would not recommend anyone else go.
But I do have to say, we started out the Zoom call talking about, kind of where the majority of our population is in terms of a headspace, right? We had a beautiful life here in San Diego. People are rushing to get back to that. And there's very little appetite for staying inside and staying at home and, being physically distant and, doing those things that we were doing back, between March and May of 2020. And economically, there's also, a cost of trying to keep all of those things with some constraints. So there are going to be more and more invitations, whether it's through the educational systems, through our arts, through our religious gatherings, et cetera, for these kinds of for us to be making these kinds of decisions. And I think it was Judy that, pointed out like the complete worst case scenario of, no ventilation, no known vaccination status, no masking, like no distancing. How could you possibly ask me to come and do this? Well, you could flip that and you say, okay, perhaps there's a scenario where, I don't know what Old Globe's doing, so I don't want to, which I'm with Jamal, like on my initial gut reaction, I'm like, ah, but we don't know if they've actually changed out their ventilation system. I haven't toured the place to see kind of, what the airflow looks like. I'm sorry, Siri is trying to engage in our conversation. And perhaps, they are spacing things out inside, even though they have a high, I don't know what's happening, but I would say, at universities all around the country, ours at UC San Diego being one of them, we have people coming into classroom settings with lots of people in the classroom. They're masked in KN95 masks. We have changed out all of the ventilation system. We monitor our wastewater. Like, we're kind of like trying to stay a half a step ahead of the virus, and perhaps some of those things are happening in these venues. I'm not sure. I will tell you there are like 15 things that I would be asking questions about before I jump out of that airplane.
Thank you. Thank you so much. Mother Sue Latimer is here. And Sue, great to have you with us. She had a question around in chat around the basically, why not just get the booster in 6 months and why wait till 8? What would you say is the reasoning for that extra 2 months? Are we trying to stretch out our vaccinations? Is there a scientific reason to wait those 2 months when we know that the immunity starts waning at 6? Can you give us some insights to that?
So I can probably, so there's the individual and then there's the public health. There are many people who I think have a valid point that say that right now, no one needs to get a booster right now when there are so many people in the United States and in the world that haven't had the original set of vaccines just yet. And so we should be concentrating on those folks who have not been vaccinated at all. So the longer we can, stay safe, 6 months, 8 months, whether it's a year, the FDA and the CDC still have not officially, recommended getting boosters yet because they don't have the science as of yet. And so there's definitely a lot of communication and discussion about this topic right now. So between 6 and 8 months, there's probably no science in between that. Probably the further out you can delay it, or it's probably better for the public health. And the more people that get vaccinated, then the less variants we'll have potentially. And so we need to try and balance the individual health with the public health always.
Thank you for that. And a great question. We have some other ethical questions coming up. Hank pitched us a tough one but this is like I'm sure that students are going to be writing in their medical ethics papers, like the Hippocratic Oath up against denying care to people who've chosen not to be vaccinated. What is the ethical argument either way? That's putting both of you a bit on the spot, but it's certainly something we hear discussed quite a bit. If people at this point are making the choice not to be vaccinated, what does that mean in a medical system where we're trying to take care of people who have made a different choice, or who might not even be in for COVID, but are finding that there's not the ICU bed they need, et cetera? Are either of you willing to go there? That question?
I'll just, quickly say that, it does raise more questions than, answers, because as I see it right now in our system, we have 20% of our workforce calling out sick because, they have waning vaccination coverage and have been infected, even though fully vaccinated as healthcare workers. And we know that is connected to the number of people who are without vaccine in any given, community. And so the idea that being against vaccination is about individual freedom. What about the ability of our healthcare workers to be free from infection? That's not their choice when infection is in the air because of a choice someone else has made. So, it's a very complex set of issues that, we have to weigh through. And I think they're, to Jamal's point, they're community level conversations. And that idea that my individual freedom is the highest priority in any one scenario becomes problematic when we're trying to get through a pandemic, which is a community level situation.
When you say 20% of your workforce, are you talking about the UCSD health system or UCSD in general? Wow.
Yeah,
20%.
there's a publication in the New England Journal of Medicine about maybe 2 weeks ago now that documents the waning coverage that our healthcare workers are experiencing. And, it's not September 20th yet when they get boosters, right? And so they're sitting in this space where it's like they're walking around with limited coverage, and there are people who have a higher likelihood of transmitting things to others. And because of the seeding of the Delta variant, even the people who are vaccinated can now also transmit to others. And it's a recipe for a very complex set of circumstances.
Wow, thank you. Jamal, do you have a desire to weigh in on this?
I think Cheryl did a great job. We'll get to some other questions.
Hank, thank you. That was a challenging one, Hank, but I know you're asking the question a lot of people are asking. So thanks for your courage and just putting it out there. Pat and Jeff have their hands up.
Yeah, hi. We have actually 3 little questions. They should all be quickies. One is regarding flu vaccine and COVID vaccine. There is a
booster.
Just having the 2 vaccinations. Isn't there a prescribed interval between the 2 or between any 2 vaccination types? Like 2 weeks, I think I've heard. You should.
That was the recommendation. They've changed that recommendation, and you can get them at the same time now.
Oh, really?
Influenza and COVID.
Yes.
Okay. Well, thank you. Thank you for clearing that up. The other thing, one other thing was we've been experimenting with the indoor gathering phenomenon. Right now we're in Palm Desert, and we went to church today at St. Margaret's. St. Margaret's is about 4 times the size of St. Peter's.
Or 10 times the size, yeah. Yeah.
It could swallow up a lot of St. Peter's houses. And they were mostly widely spaced. They mandated masking, and but you could see little clusters of friends or groups or whatnot who were sitting side by side or close together. So as I say, we're experimenting with these different kinds of situations. And one of the things that comes to mind is if you find yourself in a situation where you're not terribly happy about the conditions, and you feel like you should be tested, what is the easiest way to get a test?
I mean, I'd probably say these pop-up testing sites, you can get tested at CVS, Walmart, Rite Aid. Obviously, yeah, if you're, out of town, if you're home, your doctor's office, is probably going to have tests. I will say there's a national shortage of the Binax rapid test nationwide, but there's still the Abbott test, which is also a 15-minute test. And there's still the regular PCR testing that you send to the lab. But just the Binax now rapid one is a national shortage. But yeah, those would be you can get there. Hopefully there are testing sites all over now.
And those are all walk-in?
Usually, I mean, each one is different. Each one is different. Some may be appointments, some may be walk-ins. Just look at the ones that might be closest to you.
Okay.
Yeah. What I like about your questions, Jeff and Pat, is that these things should be done with a level of consideration, right? So I like that you call it an experiment, and I like that you're very interested in understanding the potential impact of what you just did, and to do that as quickly as possible, I think is really, and to also be prepared to know where you would go and get a test. should you start to feel like I was out, I feel a little symptomatic, or I feel a little funny, like, how do I take care of this quickly? So the rapid tests, to Jamal's point, are, there and ready for us. But I think what Jamal said about the shortage tells us that you're not the only ones experimenting. A lot of people are experimenting, and a lot of people are wanting to know, was that, a failure or a success?
Right, exactly. The last thing is, I don't even know if I should out this situation, but I understand now that CVS, for one, will give booster or give third vaccination injections without question. So I don't know if that's a good thing, bad thing, or how do you feel about it?
Yeah, I hadn't heard that. I certainly think I want people to get vaccinated. I certainly think there should be an orderly structure to things, because when you just open it up to everyone, there definitely are inequities that will happen. And so we have to be cognizant of that as well. And so there should be some structure to this rollout. That's just off the top of my head.
Okay.
I have heard, and I know people who've gone in to get their third shot. I have mixed feelings about it because if you remember back when the vaccines first became available, it was a miracle to get a vaccine, right? We had an issue with supply. We had an issue with, kind of just getting a structure together to get it. And back then I kept saying, we figured out how to do 7-Eleven, right? You can get a snack pretty much anytime you want. Like I was like 24-hour, vaccine operation shops until everybody gets their vaccine. That was my approach, in my head, right? And so I'm, sort of in the same space now with the booster, where it's like, okay, if we know we need them and they're available, open up shop 24/7. Anybody who wants to get it can get it. And I am super concerned about what Jamal raised about, if you want it, you should be able to get it, right? So that if that means you live in an area where there are access issues, or maybe you're homebound. Like I know someone who's released from the hospital, sitting there, can't get out to get it. So we need to be mindful of those scenarios as well and accommodate for that.
Okay.
Fran, I see your hand. We've got Michelle, Cinda, and Cindy Mathis lined up as well. Fran, or is this a tie on to what Pat and Jeff are asking?
Yes, real quick. I went to 3 CVS stores in the Encinitas, Solana Beach, and I was denied unless I had doctor's proof of immune deficiency.
Okay.
So it's not universal, Jeff.
Word has gotten out. Okay. They may have gotten a phone call because I had heard the same thing you had, Jeff, about that. So
They
okay.
may well be rolling back on their position on that. So yeah.
Okay, thank you. So Michelle had this great question that she had heard or even read that Pfizer is not holding up as well as Moderna against the Delta variant. Is there science behind what she's reading, or can you give us any insights to that, as we, are very emotionally attached to which vaccine we got?
I'll just quickly say, and I'm Jamal, I'm sure we'll have greater insights here, that I think it's a timing issue. So Pfizer came on the scene earlier than Moderna did. And so the waning effectiveness over time has caught up with Pfizer sooner than it has with Moderna.
Just in time for Delta.
It's not that the vaccine is ineffective. It is just that the amount of time that's passing for people with Pfizer is, 1 or 1.5 months ahead of Moderna.
Interesting.
Yeah, I'd probably say the same. I think they still are both working, moderately well. But there is research going on, and there will be, information coming out soon, with relation to Delta and the Pfizer versus Moderna. But there is research coming. It's not just been publicized just yet.
Yeah, I think those of us who had Moderna want some bonus out of how cruddy we felt after our second shot. That somehow, having had that there's a really good reason for it. extra super immunity. But okay, we'll just wait for the science to actually come out as opposed to our wishful thinking. But great question, Michelle. So Cinda wanted to know how close we are to having Moderna be approved as opposed to authorized.
So I know Moderna submitted their what's called a BLA biologics license application on August 23rd for actual approval. So it is now with, the FDA for review, which may take several months to get actual approval. And, the approval process, basically you add on 6-8 months after the authorization to collect more data to see if things actually safe, in the long term, because we didn't have that quote long-term data after the emergency use authorization. Is it safe? Is it effective? Are there any side effects that they weren't seeing? And the big thing for the pharmaceutical companies is that they can now market. Once you get advertised, you can market to the general public. So you may start seeing commercials for Pfizer vaccine, which is now going to be marketed as Comirnaty. And you might see commercials for Comirnaty. So now, because now they can advertise, and they can market for it. And so Moderna is on that process as well. It's with the FDA now.
Thank you. Cinda also had a question about blood tests to assess immunity. Can you speak to those options for kind of getting a sense of how immune are we and do those blood tests work?
Yeah, I got this question the other day from someone, and I ran it by the smartest virologist I know. And he said, no, you cannot use these tests as markers of your immunity. And so as much as we'd like to think that, we could just go in and check with these blood tests and rest assured, at this point, we cannot.
Okay. Cindy Mathis.
Dr. Schooley, I'm sure I should just give him credit. Dr. Chip Schooley.
Thanks for that. So Cindy Mathis is with us. Hi, Cindy. We miss you. Great to see you on Zoom. You had a number of questions you noted.
Some little ones. I miss all of you, and thank you for having this forum today. Hi, Jamal and Cheryl. I'm up in Pleasanton in the Bay Area, and I guess I need to ask for prayers because our church is open, and I am singing in the choir, and we are all masked, and our church is larger than St. Peter's, so I feel safe. We're actually hybrid, so most of the people are home, the ones that feel nervous about coming to church. But I've been back for the last month, I would say. Couple things. I have grandchildren that are age 6, 7, and 9, and I don't remember you answering. Do you know how close we are to a vaccine for them?
Again, that'll be some months. The data still needs to come out on the research for those age groups. Okay. It's active, but it'll be probably at least 6, probably 9 to 12 months.
Really? I've been hearing maybe possibly by the end of the year or the first of the year, next year.
That would be ambitious, but wow. Possible.
We're just so nervous up here because I don't know about San Diego, but I feel like there's more people up here that do not want to be vaccinated. And we will feel much better to know our children have had the vaccine. My adult children here in Danville area went to a place for their vaccine and did not know what they were getting. And apparently every day they changed the vaccine. So my kids on the day that they went got the J&J. And so I'm really sad to hear you say earlier that they cannot mix to one of the other vaccines for a booster. That is true, huh?
Well, and as with probably all of our comments and recommendations, that's the current recommendation. Possibly once they do some research about mixing vaccines, that it may be allowed. But as of right now, the CDC does not recommend mixing doses. Now, Yeah, now there is the whole, they've done research, meaning in other countries where they've mixed actual vaccines and seen higher antibody responses. So there's some evidence that mixing vaccines actually works, and it works better than just one, two of the same vaccines. And they've actually done it both ways, where they actually mixed the AstraZeneca with an mRNA, and that worked really well. And then they did the opposite, the mRNA with the AstraZeneca, and that didn't work as well. They have not done the studies with Janssen yet, but the Janssen and AstraZeneca are the same format, that adenovirus type thing.
Well,
So
they were
a little more complicated.
They were very excited at first because they just had to get one shot. So they said, yay. And then as the news comes along, they're really disappointed and really worried about their own coverage. I'm in a retirement community with 800 people. And if you can believe this, in all of these, 18 months, we've had only 2 COVID cases amongst the residents. And I think that's amazing. The ones that are getting the COVID are the staff that are coming in from outside, that have more outside contact. And so that's what's been hard. But I really have felt safe here in all of these months. But it was hard to be locked in for almost a year with meals delivered. That part has been hard. I guess my last question is, will we ever be out of this when we have so many people that just will not get the vaccine? I just feel like this is gonna go on forever and ever.
I know you said you couldn't fortune tell, but is there, can you give us some insight on, is there an end that we can imagine an end if we don't change that attitude about vaccination?
I will give you some perspective. There has been no public health success story around viral protection that does not involve a vaccine that we all take. You do not eradicate or control these types of infections, or the ones that will come after, right? Because this is not our last highly infectious agent that's going to come into society. It just doesn't happen. And so our options here are continued physical distancing, which the most effective was putting us all into stay-at-home orders, right? Hygiene is always important. Masking if we are going to, mingle, and the vaccine. Taken together, they're all going to be way better than any one alone. However, the vaccine is a critically important part for control and eradication of this virus. So, Cindy, I'm with you. Like, we're ready to have this be done and over with already. Human behavior has got to cooperate, and we have to find a way to listen to individuals who do not want to vaccinate, try to really understand and educate as much as we can, and hopefully shift minds and hearts into a place where people can think beyond themselves, and the value in prevention, or the value for prevention, gets elevated. Because when you talk to people about, not having had 11,300 deaths because of measures that you took, it's hard for them to wrap their brains around that. What they can wrap their brains around is, oh my gosh, the hospital is full. Now what, right? But the deaths averted and the illness averted, we have a hard time getting people to really get excited about. So I think each of us, every one of us, every day in our conversations, don't just, turn your back to the people who say, I don't want to do this. Really turn your face to them with a mask on and say, help me understand, or, are there things that I can answer for you? Or is there a resource that I can provide for you, so that we can get a better handle on why this decision is the decision that you're making? There is no way out without this vaccine, no way out.
I would say that my quick answer is that I'm hopeful that, and positively hopeful that this is going to end. And one of the big reasons that I am hopeful is, I think, not to be political, but different leadership. And I think leadership and the decisions that the leadership are making right now to get people vaccinated. We tried the incentive programs all over the country, and that worked a little bit. But now we have, mandates for federal workers and, contractors. The federal workforce the federal government is the largest employer in the United States. That was step one. Now we've, gone down to, businesses, 100 or greater, mandating vaccines or testing. So when it affects people personally, again, Cheryl said, we can think altruistically and then we can think personally. And I think obviously more people hopefully will say succumb to vaccination if they were in opposition prior, and that I'm hopeful that things will get better.
Thank you. Were there any other questions, Cindy?
I was just going to say, those of us that are older, my generation, that lived through the polio, I think about what my parents or all the parents at that time thought about getting vaccine for their children and how hard that must have been. But this should have been mandated, as we all know, long ago, I think. I feel this is almost too late. Will it take someone in their family dying before they wake up? That's my thoughts.
Well, thank you, Cindy. It's great to see you.
Thank you.
Hank raised an idea, I'd love to float by you, that the time between your first and second mRNA shots also affects efficacy. The longer time in between, the more efficacy. Is there some information you can give us about that? Or is that something you are aware of or have seen, or is that another idea?
Yeah, that would be an idea. So no one has looked at that at all, because they have to be very structured in their studies, in their science. So either 21 days or 28 days in between the two, and they have not done any research spacing that out even further. So that's an interesting question, but we have no information on that at all.
There's sort of a follow-on from Linda. Curious to know, if I wait to get a booster more than 8 months, does that also prolong your strong protection from the virus, or is it just make some difference after 8 months, just get it done? Right.
So yeah, so again, we are all the first people who are going to get boosters. So we have no information about how it's going to work because it's all happening for the first time.
Okay.
So yeah, those are great questions. But we, unfortunately, I'm honest with you, when we have information, we have it. When we don't, we don't.
So we'll ask Nancy McMahon's next question when you come back about how long it took the boosters to last. Because by then the medical workers will have had theirs for a while.
Exactly.
Okay. All right. So here's a question on ethics, but also the testing and research for the vaccines. Cinda's had several friends who won't get vaccinated because they say the vaccine was tested on aborted cells or cells from aborted tissue. She's having a difficult time convincing them. Can you offer any help in that scenario?
Interesting. I've had a physician friend who was of the same opinion. That's one of those, religious, considerations that, we're not going to convince everyone. That's just, unfortunately, that's a valid concern. And we accept that. I don't know if there's any way to talk around that issue. It was tested, on those types of cells. And, I don't have a good answer for that, unfortunately.
Is that all of the vaccines or just one of the varieties?
From what I've read, it was just one, and I can't remember which one off the top of my head.
Okay. So that might be a place, Cinda, for you to do some research. If it's just one of them, then they have options. That wouldn't be a factor of if that's the case. Thank you. That's another. We've hit the science, we've hit the ethics today. It's been some really great and complex questions. Any other questions for Cheryl and Jamal while we're together and have them here? Well, you two have been amazing as always, and we're so grateful. So very, very grateful. I'm seeing the silent and muted applause around the screen. Is there anything else you would like us to know besides get vaccinated if we haven't been already, and tell our friends while we have you with us?
Yeah, I would just say that, coming off of yesterday's, and really it started really in the middle of last week, just hearing so much about what happened 20 years ago on 9/11, and just remembering how that disaster brought us together as a nation. There were no red and blue states, right? There was no Republican, no Democrat, no independent. We were Americans. And, that's what disasters can do for us. And I think right now we're in a place where, the physical health fallout, the mental health fallout from this pandemic is severe. It is a big, big deal. And I'm hoping that we'll unite as Americans around this issue and try to get our communities into a space where we can eradicate this SARS-CoV-2. It is unthinkable to me that we're looking at possibly another year or 2 years when we have readily available opportunities. And so I'm hoping, Jamal mentioned earlier, leadership matters. I'm really hoping that we can find a way to unite around this and get through it.
Thank you so much.
I will close with, if we're talking to people about whatever the issues may be, vaccines or, treatment options, listening. And please listen to one another versus trying to pepper people with information. Listen and try and, empathize with their thoughts, make them feel validated, and then then give them options. Be prepared with resources, be prepared with where you can go with them to get vaccinated. But listening is going to be that will get you so much further than trying to, just push your own agenda on someone. I will say, healthcare community are tired. I've had staff almost threaten to quit. I've had non-healthcare staff yelling at healthcare staff, "Why are you testing so much? You need to stop testing." And then my staff crying, we don't want to do all this. We're just trying to keep people healthy. And so it is definitely a burden for us. And we appreciate all of you that have been vaccinated, that are trying to get the word out. We appreciate all of that because it definitely is weighing on us heavily. But we will get through this as we've done everything else. I'll finish there.
Well, thank you. Let's pray for Cheryl and Jamal and all of our healthcare workers and public health experts and leaders. The Lord be with you.
And also with you.
Gracious God, we give you thanks for all those who are working so hard to try to keep us safe, to try to heal us and bring us and our community back to wholeness. We ask that you strengthen them. We ask that your Holy Spirit fill them with your perseverance, your resilience, and your grace. Help them to know that you are working in and through them, and that it does not need to be their strength alone that propels them through their days and their weeks, but that you are right there by their side, carrying them, holding them, and encouraging them. At the same time, gracious God, we pray for the rest of us. Please help us do what we need to do to lessen the burden on our healthcare workers and public health leaders, and help us as a community to make choices that bring this pandemic to a close, to return our lives and your world to a better state of health and wholeness. We pray for those who are struggling and those who are suffering and those who are grieving because of this pandemic and things related. And again, we ask that you hold them closely and help them feel your presence with them. And so many prayers in our hearts that we are not saying aloud, we lift to you as well. With such gratitude for how you've carried us thus far. We pray in the name of your Son, Jesus. Amen.
Amen.